Conspiracies Against Wellness with your host, Janelle Elgaway.
Good evening and welcome to Conspiracies Against Wellness. I'm your host, Janelle Elgaway. Tonight, guest Paulette Wright will join us. Paulette is a family nurse practitioner, chronic pain patient, and advocate. If you have any questions and would like to call in, please do so at 415-915-2291. You can also listen and chat live with our audience from YouTube channel Conspiracies Against Wellness live stream. Next week's lineup is Dr. Klein at the Doctor's Corner on Tuesdays and Dr. William Mangino Wednesday, May 16th. And now for tonight, welcome Paulette to Con Nation. How are you this evening?
I'm good, Janelle. Thank you.
Well, we're glad
Thank you for having me.
Yes, absolutely. So, can you please tell me a little bit about yourself? About your profession.
Okay. Well, I'm 65 years old. I started my profession when I was 16 years old as a nurse's aide in the convalescent hospitals and geriatric facilities. And I then decided that I was going to be a nurse. So in 1970, I went into the nursing program at Portland Community College and graduated in 72 with my LPN, licensed practical nurse. And then 7 years later, I went to Bakersfield College and got my registered nurse. And then in 1993, I had applied for UC Davis, California, Family Nurse Practitioner Physician Assistant program. And I graduated from that in June 1995.
Okay, great.
And
we'll go into that a little bit.
I'm an alumni of UC Davis.
Great, awesome.
To this day.
Mm-hmm. Well, congratulations. And
a wonderful career in rural health. We were taught to do everything.
So I know you're a chronic pain patient as well. What health issues do you currently have?
Well, at this time, I was diagnosed with polymyalgia rheumatica in 1995. It was like lupus symptoms. After I took a drug, isoniazid, for a TB exposure at my Kaiser clinic I worked at. And it gave me like fibromyalgia symptoms. That's how I explain it to the public. And severe muscle pain and chronic fatigue, severe chronic fatigue. It hit me very fast after 4 months of taking the medicine. And then I have degenerative disc disease. I've had 2 spine surgeries, one in 2009, L4 and L5, and then again in 2015 at Cedars-Sinai, Beverly Hills. Dr. Michael Croft, from T11 down to L5. I worked critical care for 25 years of my nursing career, and I lifted, 200-300 patients. We didn't have help at that time as nurses. We were at the bedside. Mm-hmm. So I really wore out my spine in recovery room, pushing gurneys, all that.
I bet.
So that's the diseases I have at this time.
Now, you didn't have
otherwise very healthy.
Right. Well, of course. Now, you didn't stop working because of all this, correct? Or quitting work, exactly.
No.
So why did you have to quit work? What happened there?
Well, after I had taken the medicine for 4 months, I was sitting at my desk, and I was seeing at the Kaiser Clinic. I was a primary care provider, and I was seeing about 30 to 35 patients a day, and I couldn't get off my chair because I was so fatigued, and I didn't know what it was. So at that time, Kaiser was under union, and so I was so fatigued, I had to quit that Kaiser clinic because it was union, and I could not go part-time. Mm-hmm. So I went part-time after the incident, and then I was diagnosed with the fibromyalgia. But I went to part-time from 1995, or 1996. Actually, it was in 2000. I went to part-time, and I had frequent bouts of having to be off work for quite a while.
How were you able
to get my energy back?
Right. How were you able to start working again as a chronic pain patient? that must have been tough.
It was. I had to take anti-inflammatories. I was on doses of steroids for a long time and a pain pill. And I had to take a pain pill every 4 hours. I had to take a hydrocodone every 4 hours in order to work. I had severe TMJ in my left jaw, and that was from grinding my teeth at night from so much pain. I could not tolerate anything in my pain management but hydrocodone. Everything else was kind of too strong for me, or I don't like to feel out of control at all. And I had to be awake on my feet all day diagnosing patients. So it just was not safe for me to take anything but hydrocodone.
Now you were allowed to work, right?
I never had a complaint. I never made an error in medicine.
Now, you're allowed to work while taking pain medication, right? I mean, there's no legal issues? Okay.
Of course.
Now, you also moved to Arizona. Why did you move there?
I moved in 2002 to Arizona because of the fibromyalgia and because my parents were aging here in Lake Havasu City, and so I wanted to be near them. And also I had the desire to open my own practice because I'd done everything in hospital and home health. I'd done it all in medicine now, even surgery, minor surgeries, and I'd worked every area of the hospital and home care. And so I wanted to open my own practice. So I came to Lake Havasu to help my parents and to feel better in the desert.
Absolutely.
That's the main reason why I moved, hopefully.
Do you believe the medical field treated you just like everyone else, like they did with everyone else as a chronic pain patient, and because of your profession, or did they treat you better, worse? Like how did they treat you?
I think I was treated better. My physicians that treated me always knew that I was competent and capable and doing a great job. My physicians were usually in my same area. That I was a small town that I was working in, so they all knew me and they knew my patients, so they knew that there was nothing wrong with my taking my medicine, and I was controlled, and there wasn't any problems ever. So until I moved to Arizona.
Right. So, and then what happened in 2006?
And there's still there still wasn't any problems in Arizona until when I came to Lake Havasu, I started working in an urgent care setting, and I worked there for 5 years and had no problems at all doing minor surgeries, and I even had some family practice patients. And then in 2005 came the ringer. I had built a new home with a pool, and I fell cleaning my swimming pool, and I fell on my coccyx and hard, and in that immediately in the next week I was having sciatica down both my legs to my ankles.
Yeah, I bet.
And I could hardly stand up. When I'd stand up, the pain would immediately start. Now, I did not take my hydrocodone all those years, continual through all those years. Frequently, I stopped my medicine because I didn't need to take it all the time.
Right.
So, I mean, I did not take it for months at a time. I was not an addict, obviously. You know, this is one of the main things with our medicines is they automatically, people think that you're an addict because you have to take a pain medicine. No, I did not I could put the medicine down for a year and restart it if I needed to. Well, I had to restart it in 2005 when I fell. Right. And I went to the rheumatologist pain management, which worked within Midwest, our group, medical group, and he started me on other types of medicines that were stronger, and I couldn't take them. But I decided at that time that I would open my own practice, my own family practice, so that I could customize my hours shorter every day, which was not a good business idea, but that was what I thought I would do. And I had about a 200 patient following. The name of it was Holistic Healthcare and Family Practice.
Now, did you have your DEA license at this point?
Yes, okay. I had my DEA. I've always had my DEA since I've been a nurse practitioner.
Okay.
In 95. So I've never had a problem. But anyway, so I decided I would work on my own, and I got a complaint in 2000. 6 from another nurse practitioner and a marriage family counselor who said I was acting funny. And I was,
when you say acting funny, what is acting funny? What do you mean?
They put in, they said that the facts, I'm looking at the complaint as we speak, and the facts that led to the discipline are then in late 2005, 2006, and mind you, this is when I opened my practice, respondent displayed unusual behaviors, including mood swings and hearing things, and has had behavioral issues. She also took more controlled substances.
Wait, they're saying that you had behavioral issues in the past that were written up, or what? I mean,
that's what the board accused me of. This is the discipline that I'm looking at right now, and this is what the Arizona Board of Nursing wrote. In the discipline. It was lies. I'd never had any behavioral issues.
Right. What other complaints did they have?
It says she also took more controlled substances than she reported to the board and medications that her physician did not want her to take.
So did they talk to your doctor? How did they
lie.
know? Right.
They had no proof. This is gossip lies from another nurse practitioner who was my competition in town. She did not want me opening my own practice because she was the only other nurse practitioner in town, in this small town. And so I was her competition. And so that's what she told the board, or that's what the board wrote in my disciplinary action, that is on the national data bank for all the world to see.
Wow. So,
yes.
Why did they take your license, or did you surrender it, and why?
No, what they did is we went through, one time I got to go up there, and when I got this complaint in the mail that I had a complaint, I said, oh my goodness, well, let me come up there to Phoenix, and we're going to clear this up right away. So I had an appointment up there in 2 weeks. When I went up there to the board, I got about 10 minutes with 2 nurses, RNs, and they were asking me questions, and they said, we want you to go home and close your practice.
What?
You close those doors. You will not practice again.
And what kind of proof did they have? All these things that
they had no proof but the gossip phone call.
Wow.
Phone calls from there. No proof at all. They had done no investigation with my doctor. They had no proof at all. So I told my doctor, what had happened, and I had to close my doors. I had a couple hundred patients.
Yeah.
And I had to close my doors and say that it was due to the Arizona Board of Nursing.
Okay. So
they had no proof.
Once they did this to you, what did they do? What did they make you do afterwards in order to try to get credibility, to be able to get your license? Yeah. What did they make you do?
They told me that I had to go through a probation. It was a lot of paperwork, back and forth, legal paperwork. And so I got 5 minutes to go in front of the board to defend myself. 5 minutes. 5 minutes. So I go up there to Phoenix, and I go into this like a courtroom situation. The board is sitting up there. 5 minutes, the nurse after nurse go in front of them. 5 minutes they're given, and then you go home and you get your paperwork. Well, I got an option to surrender my license or go on probation.
Okay.
And so I was given a disciplinary action for these women's lies about me with no investigation.
Who are these nurses? I mean, how did they?
They're nurses.
That's it. So any nurse could go and just file a complaint against you, and if there's 2 people that are doing it with no proof, they can actually make you close your doors. I don't understand that. That's
yes. They should have had. I was told by my attorney. I got an attorney.
Okay, good.
And he said that they should have had a court order to close my doors.
Right.
Well, at that point, I was in a lot of pain at that point. And so I had to take off work. And so I applied for a Social Security disability.
Right.
Because I didn't know what was going to happen. And so then I applied for Social Security. I lost my home. I went out. I had to claim bankruptcy. I lost everything. I was flat in bed. Of course, all this stress was making it worse.
Right.
So I didn't work for a couple years until I had my first back surgery. And I went back I found a surgeon. They condemned me. Oh, my gosh. They said I was doctor shopping because I could not find a correct surgeon that I liked and knew he would fix me. I went through many interviewing surgeons, and this one surgeon here in Havasu, he did 4 MRIs, and he still couldn't see what was wrong. So I ended up, over a couple years, I finally ended up with a surgeon in Flagstaff that fixed my back in 2009.
Okay.
And he said it would need more, but right now that was a quick fix. He put a plate in. In 4 months after my surgery in 2009, I was ready to go back to work.
So let me ask you something, though, because before all of your, so your health issues and everything like that, you had, all your doctors seemed to treat you very well at first. Do you think it had anything to do with these nurses and this medical board?
It was only the medical board. My doctors treated me just fine.
Okay.
It was the surgeon. I was
Gotcha.
trying to find a surgeon to fix my back.
All right.
And I was going back and forth. I was doing all the therapies there was to do, whether they were alternative therapies. I hung upside down. I had physical therapy 3 times a week. I did pool therapy. I was having massage 3 times a week in my home. I had to move to my parents' home. And I was doing everything I could to get better. Mm-hmm. And I was having hormonal treatments, all kinds of things, because my whole body I lost 20 pounds immediately and was on pain medicine that, wasn't doing anything. The sciatica down both legs was overruling everything.
Right.
So I couldn't even sit. I had to lay flat. I couldn't sit. I couldn't lay on the sides of my legs because my sciatic nerve was so irritated. So I couldn't even lay on my sides.
But you got the surgery, and then you started feeling better, correct? So then you wanted to start working again.
Well, I did. I was still at my parents', and in 2009, I got this phone. I put my resume online. I couldn't get a job because of this data bank information that's out there. Mm-hmm. I got a lot of jobs. I had a wonderful resume, never a problem in my past. So I had to disclose to any employer, I would have to disclose everything about me. All my medications. I had to go back to work, I had to have a supervising physician. I had to call in and get a urine drug screen every day. I'd have to get a number through an agency like Task. I had to call in and see if it was my color so that I could go to Sonora Quest and pay them $40 so I could have a urine drug screen.
Wow, that's an awful lot to have to go through to get back to go to work again. And you'd think that they would want you to go back to work, but it sounds like they didn't want you to. Nobody.
Well, they wanted me to fail. In fact, they claimed I missed a urine drug screen, which I never did. I never missed a day of calling in, and they claimed I did.
Wow.
But they want you to fail. Mm-hmm. And so I get a call from this woman up in Phoenix, and she says, I have had a doctor be on probation, and we got him through his probation. I'll get you through this probation. I didn't know I was being set up. I had no clue. Mm-hmm. So I go down. I talked to her for a few times. She said, I found your resume. I know about the problems you've had. So I go down to interview with her, and sure enough, she knew everything. And so I agreed to work for her. It was in a very bad area of town. Her family ran these 2 clinics. And it was scary. They had a lot of drug trafficking through the clinic.
Really?
She was billing. Oh yeah, it was the worst clinic that I could work in. It was so dirty. Every morning I had to clean the rooms before I worked. That's how bad it was. It looked like they trashed the clinic every night. So I worked for this woman for a total of, I think it was like 2.5 years, and so. She asked me to come back to her, and I did, and she said she wanted me to help her clean up this. So I got through the probation, 2 years. Mm-hmm. I got through the probation. And then when I quit, I told her she wouldn't credential me for Medicare and Medi-Cal, and she was fraudulently billing under other physicians' names. And I was working as a solo provider in one of the clinics. And when I figured all this out that she was doing, I had gotten through my probation, and I said, okay, now it's time to quit. And she was supposed to credential me with Medicare and all, and she never did. So when the reason that I quit and she kind of fired me is because I found out that she had not credentialed me this last time I went to work for her.
Okay.
And so I turned her into the Attorney General.
Well, I was going to say that whole 2
Ron
years.
Ron Davis.
Did you keep your head down kind of because you wanted to make sure that you can get through the 2-year probation period? Or?
Yes.
Okay.
Yes. I had to agree to everything she asked me to do. I was a slave to her. Her family used my car. I worked overtime. I worked weekends. I did anything that woman wanted. When she said jump, I said how far.
Wow.
Because I had to get through that probation. And so when all this information is out on the database, you cannot get a good job with, I applied at IMS. I was hired there 2 weeks. When they figured out that I had this big of a problem when they saw the data bank, I was fired immediately.
Okay.
So
what happened?
So I got through that first.
Right.
So then when I quit, I was angry at her because she had not when I found out she hadn't credentialed me, I was very upset. And she came to me yelling at me because I had called Medicare.
Mm-hmm. Hey,
and
Paulette,
so she was very.
When you say credentialed, you want to tell our listeners what you mean credentialed by Medicare and Medicaid?
Oh, well, they're supposed to. Your employer is supposed to. We have a national provider number that they're to bill under. Mm. And she was not using my national provider number, and I was an independent contractor working for her. And so she was not taking taxes or anything out on me. And she was to bill with my national provider number. And that was our agreement, that I would work 40 hours a week for 5 years. And she would be billing under me. Well, she never did.
Oh, wow.
She always fraudulently billed. So when I found that out, her and I got into, she was yelling at me first. And then I kind of listened to her. And then I walked out, and she was still screaming and yelling at me because she thought she was being caught by Medicare, and she was. So I went right to the Attorney General after I left, and then in another week, she had called the board with another complaint. She knew another complaint would take me out.
Right.
Would take my career out.
What did she do?
So
what did she say?
She called the board, and she said that I was prescribing my own medications.
Oh,
that
no.
I wasn't. Dr. Kennedy was. He was the doctor in the other clinic that I saw every month. She had no proof, but Dr. Kennedy, they had my chart because he was my doctor. So she fraudulently she broke my HIPAA law. She took my chart to the board, and she dissected it. And Dr. Kennedy, when I'd see him every month, he would say, okay, write down these medications and your refills, and all that. And I did for him, just like he asked me to. That was his protocol when he saw me or anybody. He didn't like to document, so he'd say, well, write down your medication refills and, what you're taking out, all my records.
Right, but you're not writing out your own prescriptions. So what I don't understand is how could people just, just say something and it's being taken as the truth or real? How does that happen?
Janelle, I was told by the executive director at the Board of Nursing here in Arizona, we got into the power struggle because I was innocent. And I was telling her, one time I've gotten to speak to her by phone in this 12 years. And I told her this last time, I said, this is wrong. These are lies told about me. Dr. Kennedy co-signed everything in my chart, everything. And she told me that I was guilty because I received a complaint from anyone. Your ex-husband can call in, and if you get a complaint, you'll get a 2-year probation. It gives their investigators a job for 2 years monitoring that nurse.
Oh, I see.
They have around, if you get the Arizona Journal of Nursing quarterly, you can see everybody that's been disciplined. And there's probably, I don't know, I would estimate 50 a month. So how many jobs are investigators getting at the state board, getting paid? They still get their paychecks.
Wow. Wow.
And then they also made me have psychological testing. So the first time I had to pay for 2 psychological tests, and both of them said I was fine. But my symptoms of anxiety could be this, or this. Could be, but they weren't. One of them said, let her go back to work, but they ignored it.
Mm-hmm.
So what it does, a complaint gives these investigators a job.
Okay.
At the Board of Nursing.
So
that's what it does.
What's happening now?
That's what happens.
Yeah, like what's going on now?
Okay, so in the 2013 complaint from that lady, they did not they did not even think that this woman was the woman that got me through the first probation.
Oh.
They didn't even think about that. And if they would have seen that, and they would have seen that I went to the Attorney General complaining about this clinic, and it was so bad. Our vaccines were taken by the Department of Health in Phoenix,
mm-hmm.
and it was because the owner was so cheap, she wouldn't even buy a refrigerator to keep the vaccines. And then the secretary there in the clinic, they were so bad that they took our vaccines, and she stole some away and didn't give them all up. So she was giving vaccines that were not even they weren't even potent.
Right.
So the kids they were giving those vaccines to they're getting non-potent vaccines, so they weren't even getting vaccinated. And I told all this to the Attorney General. This specialist, Julie Colton, took the case, and they did investigations. I have asked, before I came to D.C., I wanted to see what happened, because I've done all this, and then I've kept quiet about it.
Mm-hmm.
And until I went to Washington, D.C., I voluntarily surrendered my license so that I could figure out what I could do. The first time I spent $25,000 on a lawyer. I took my case all the way to the Department of Justice in Phoenix. Mm-hmm. And the next step would be Superior Court. At the Department of Justice level, the board sent 2 attorneys and my attorney. So my attorney asked, we want this removed. We want this all removed. I was told by the judge, Eric Stratsburg, we are a state entity here at the Department of Justice, and they are a state entity, the Arizona Board of Nursing. One state entity cannot come against another.
Okay.
And so there went my $25,000 to the lawyer.
Wow.
And I didn't know what to do. I thought, oh my gosh. So I haven't hired another lawyer.
So what are you hoping happens now?
Now I am hoping with our Washington, D.C. trip
mm-hmm.
and meeting all these other physicians that medical board problems have happened, these unfair lying medical boards and nursing boards. I want medical and nursing board reform. I want their positions changed every 2 years, because if this woman wasn't in the same position she's been in up there at the Arizona Board of Nursing, if we have another person in there in 2 years, that person may see my case differently.
Right.
But this woman is this executive director. She is bound and determined. She's destroyed my career forever.
Wow.
They take nothing into your education. They act like you don't have an education. You are scum of the earth at the Arizona Board of Nursing.
Wow.
And that's just wrong. They don't look at your experience. They don't look at the past complaint. Is it related to this complaint? Is this person just out to get you? You have no... I had multiple conversations with the investigator over the phone only, never in person, never. I asked for an in-person interview over and over. Never would they give me an in-person interview. So I've only been before that board. They've seen me one time in the last 12 years for 5 minutes. Now, and I never received due process to prove my innocence. And I never knew what they took as proof. They never called the pharmacies to see where the prescriptions came from. They never they never got any evidence. None. And yet I was guilty. So now I voluntarily surrendered. They made me surrender till 2020, from 2015 to 2020 in Arizona. Mm-hmm. I can't apply for licensure till 2020. And in California, because Arizona, I had to surrender. I was forced to surrender, or I was being forced to give up my license, or a voluntary surrender for a time period. My thought was, I will have a voluntary surrender for a time period till I can get my next surgery, get on my feet, and figure out what to do. And that's what I'm doing now.
Okay. Hey, Paulette, we have a call.
So,
I'm going to take a quick call here. Caller from area code 215. What's your name?
Hi, this is Dr. William Mangino. Hi, Janelle.
Hi, Dr. William Mangino. How are you tonight?
Hi, Dr. Mangino.
Pretty good. There's some noise in the background here, so it should disappear soon. I have a couple of questions and comments that won't take more than a few minutes, and for your guest. Your first name again is what? I'm sorry.
My name's Paulette. Paulette.
I'm sorry. That's my fault, Paulette. Thank you very much. I'm so sorry to hear about all these things that happened to you. And in fact, I had brought it up before when I saw you originally when you went down to Washington, D.C. Listen, your original disability attorney, did you get disability? Were you judged to be disabled at that time?
Yes, 2008 I started receiving my Social Security disability, but in 2006, 2007 they said I was disabled. Yes. Mm-hmm. Okay.
Did that disability adjudication did your spinal surgeons who took the time to operate on you and hopefully made you better for the most part? It's not perfect.
They did make it better.
Did they take the time to write letters to the disability is a federal deal. Did they write letters to the disability judge and people like that?
No, they didn't. No.
Well, that's problem number one right there. Okay, really? I'm just going to try to resolve this for you really quickly. You can present. You're beyond. I don't know whether or not you challenged your original board denial of your credentials or your probation. Did you ever take it to court and challenge it in Arizona before the Arizona Superior? And what did they say?
Not before. We didn't get to Arizona Superior Court because I was out of money in 2008. When I paid my attorney $25,000.
Well, you could. Okay. And after the first case,
we went to the Department of Justice. And we were told that one state entity can't fight against another state entity. And that's when I was pretty well done with the attorney.
Well, why did you not go to the federal Department of Justice? Why did you presented your claim in a lower court in Arizona. Without going into detail, I'm going to presume that you basically told them whatever part of the story you're telling us tonight, which we believe and we're sympathetic to. But at the time that you went, let me finish. At the time that you went, please, at the time that you went originally before the Arizona board and you were denied your license or put on probation, at that time, you brought it before the court and you lost at the lower level, I presume. So then you wanted to bring it up to the next highest appeal court and your lawyer said, gee, you don't have any money, forget about it. I've got to take my kids to private school today.
Yes.
Something like that happened? Okay.
Yes.
Well, did you? Okay. So, but you raised all of these issues in at least one court in Arizona?
The Department of Justice. Mm-hmm.
No, I'm talking
went all
about
the way
the courts.
before just Judge Eric Strasberg. He took it to the Department of Justice there in Phoenix.
He's a disability judge or an arbitrator judge or what kind of judge?
He was there for the Board of Nursing and me.
Oh, he was there. So you had the same judge. Okay, all right. Well, I don't know. Every state has a little different, but this is a federal claim that you have now. You have a federal disability claim, and you need to find a good lawyer you might want to go to the law school at the university and talk to the people there.
Oh, you know how many? I can't get a lawyer without a lot of money. You cannot. I have tried at least 20. I've tried Gloria Allred. I tried everybody. I haven't got a lawyer at all. I cannot get a lawyer for my case. I've tried everywhere, and I've kept trying all these years. I can't find a lawyer.
Well, you can't find a lawyer because you can't afford one. But there are right. Well, you need to start knocking on some doors, and you need to you need to run it by a disability attorney. Basically you can file a suit on your own. It's got to be since you're not an attorney, you can still file a pro se suit. You can tell your story, and you can send it, and you can sue in federal court. In the district court for Arizona, wherever Phoenix is. It's either the eastern, western, southern, or the entire district. Federal court, not state court. Okay?
Federal court.
Right. And what you do, you go to the federal court and the federal district court for your town, for your city. There's usually only one or two in the western states.
Well, I would. Teresa Sanzio is a nurse, and she's an attorney for the board to defend, and she has sued the board, and nobody can get past the board. I've gone to the governor's office, the attorney general.
Listen, you're not listening to me. You have a federal claim. It has nothing to do with the board.
A federal claim.
Okay. Right. You have a federal.
Well.
Your rights were. You're going to let me talk. I'd appreciate it. I'm trying to help you. I know you want to tell the story, but we know the story. I'm giving you the best free advice money can buy right now. Go to the federal court. Ask somebody there. They're not supposed to give you advice, but every law student knows how to do it. You can find people coming out of law school. You can go to the law school itself and ask for help. There are usually committees of students and things like that. There are ways to do it. Go to a private attorney and just run the case by him. Say, look, I can't afford to pay. Could you at least tell me how I can initiate a pro se suit on my own, or get some other? There's got to be one cheap lawyer. You don't need Melvin Belli or Joey Spence. Okay, you just need to file in federal court that your rights were violated under the American with Disability Act. Write out your own words, your story, submit it to the court. You don't need an attorney. You don't need to quote legal cases. You don't need to cite federal law. You're filing a lawsuit against the state of Arizona for violating your civil rights under the American with Disabilities Act. You file it, and believe me, you'll get action. You hear me?
Okay.
They may even assign you an attorney. Right.
Thank you.
May
I have your phone number? So could you give me your phone number so I can ask you again?
I could give.
If I didn't get all this written down.
Yeah, after the show, I could give it to you. Okay.
Thank you.
Or
Ms.
we'll talk.
Janelle will tell you. Yeah, I mean, listen, I don't mean to be rude, but you've got to fight yourself. No one. Over all these years, you've done a lot of missteps yourself because the average person. Yeah, the average person. Listen, I know. I went through the appeals process. I've been to the United States Supreme Court a couple times on my own. It's not an easy thing to do. But when you have an American with Disability Act violation, which I believe you have, it doesn't matter what Arizona's rules are. If you were a judge to be disabled, you're put in a different category. You're a subset, an insular and discrete subset of people that are disabled. And because of your disability, you've been discriminated against. People just can't say that you acted funny and that you heard voices. Did they hear the voices you heard? If they know you heard voices, they need some psychiatric help also. You follow what I'm saying?
I do.
You got to get tough, lady.
I do have a civil rights. They did break my civil rights, and I do have a case with Stephen Scott.
I mean, the court,
but they're not doing anything about it. I do have a charge of discrimination with civil rights. I have a case.
Okay, so you brought it before an agent, a federal agency,
before the attorney general.
Well, that gives you. Listen, that's wonderful news. That gives you
April
even
11th,
more
2013.
Okay, well, can I just finish up and then I'll get out of your life tonight? Sure. Since you already raised it with a federal agency. Let that federal agency make a decision. And if they rule against you, while they're making the ruling, you go ahead and file a suit under the ADA, American with Disability Act, let me finish, in federal court. And the federal court, you'll tell them that your case is currently before such and such an agency. And they'll write back to you saying, we're not going to take your suit now. We're going to dismiss it without prejudice to you to refile once the other federal agency has made a decision. Now, I might not be 100% correct in the steps I'm telling you about, but some really top-notch disability lawyer, if he can get a few $100, he'll give you an hour and he'll tell you what to do, even if you can't retain him. Okay? It doesn't cost a lot of money, and you don't. And the only thing it's going to cost you to file a federal suit is a couple $100 at the most. And if you say that you're indigent, it won't cost you anything. So you got to find out how to do these things. It's not that hard. You're welcome to call me privately, and I'll tell you. But once I tell you something, don't challenge me, because I'm not here to fight with you. I care about you.
I'll follow.
And you got a screw job in plain English from Arizona.
Yes, I did.
And this is a state that doesn't even celebrate Martin Luther King's birthday. So what would you expect?
Right.
I don't know why you went to live there in the first place. All right. I'm
warmer
done.
weather.
Good luck to you.
Thanks, Dr. Mangino.
Thank you so much.
Goodbye.
Bye-bye.
I appreciate it.
Yeah. If anybody knows something, he does.
I have a charge of discrimination from the Arizona Attorney General sitting right in front of me. I have the charge numbers. I have the paperwork right in front of me.
Okay.
Janelle.
Well, so
nothing was done.
Yeah. And I'll give you his information after we get off here. I just want to know, how have you dealt with all this emotionally? I mean, what do you do?
Oh my God.
It has to be drive you nuts, right?
I am a grandmother of 4. I have 2 sons. I have I paint. I am living with my aging parents, 91 and 87, helping them. I buy all the groceries. I cook. I clean. I am still fighting for the cause, how I met you in Washington. I have called there's been at least 25, 30 lawyers I've called. I've went through the ALCU. I've went through the Attorney General, Stephen Scott. I was supposed to pick up the CD of all the occurrences at the Attorney General's office, and before I went to Phoenix, but I didn't have time because they got it ready at the last minute. But Stephen Scott at the Attorney General's, the compliance manager, said that nothing came of my charges to that clinic and that clinic owner. So I continually, I just keep fighting for the cause. I just keep purging ahead every day. I think there is going to be an attorney that is going to help me every day. And I pray. I'm very Christian. I'm very spiritual. And I know if I keep walking the good walk and doing like I'm supposed to do with my family and my career. I run support groups for pain patients and COPD. I volunteer. I travel. This is what I do on my Social Security. I'm just getting better physically. I've worked on getting better physically with diet, exercise, staying emotionally connected with friends. At first, when I was in so much pain, and before the last 2015 surgery, I got and I was in so much pain, I was going to find the right surgeon. One of my friends in California, she said, you have to go to my surgeon. Come up, put your trailer. I bought a trailer. She said, bring your trailer, put it by my house. You help me through my surgery with Michael Croft. I'll help you through your surgery at Cedars-Sinai. Mm-hmm. That helped me. Good. It's taken me 2 years to get on my feet to this point, and now I'm ready to go back to work. I want to go back to work. I want to start doing my continuing education. I have another 20 years left. Everything's perfect in my body. My bone scan is perfect.
Well, that's
my
great.
hardware, I have tons of hardware and 16 screws, 2 rods, a plate, a pelvic fixation, but I've learned to adapt to it. So I want to go back to work. Well, I want my licenses back.
Well, Paulette, I want to ask you something, because I want to ask you on more of a professional side of things. Like from the time you were working and then when you became a chronic pain patient, what did you learn about chronic pain patients in general from prior until being one yourself? Like, how did you guys view chronic pain patients before? And then, when you became one, what changed?
Yes. Okay, well, in 1995, when I became sick, I learned. 1995 fibromyalgia was not out there very well.
Yeah, I remember.
So I was shocked with that diagnosis. So I started studying it.
Okay.
And I did every research study there could be, not actively that I was in it, but I started studying on my own. And then I did family practice for so long, but see, we did pain management with family practice in those years. So I started diving into pain management, and I joined the American Pain Association. I went to Pain Week every year in Las Vegas. I educated myself. Then I went to work with Mark Grant, who's an anesthesiologist in Phoenix, and he has a pain and addiction clinic up in Payson, and I worked with him.
So you know all sides.
I dove into pain because I understood it.
Right.
I understood pain because I had so much pain.
Is this normal,
so
though?
I had empathy.
The general population of the medical professionals, do they normally know this much?
Yes.
Okay, they
do. They
all
do.
Right.
The people with pain, a lot of my pain management specialists had pain, and that's why they went into pain management.
Gotcha. Right.
Because they're the ones that know. I really didn't know about pain management, even with the fibromyalgia, that much. But when I fell and I hurt my spine, and I had that severe sciatica, level 15, the minute I stood up every day, and had to take pills so I could stand up and work, and that educated me on what pain felt like. And I could tell if I was having an addict come ask me for pain pills or if the patient was truly in pain. I knew.
How can you tell? How do you
intuition.
know? Okay.
I had an intuition. One person came to me, and this clinic, as I told you, was a real ghetto clinic. A lot of drug traffic in there with the doctor that was there. And I turned him in, too, to the DEA and everything. Nothing happened. But anyway, I knew, I could tell if a patient really had pain or not. By their records, by my exam, I knew what to look for.
Okay.
I knew.
Hey, Paulette, we have a caller. I'm going to take it quickly. Caller from 269. What is your name?
Jesse Ray, and I've got a question for you.
Sure,
As
Jesse.
a chronic pain patient myself, and everything you've been through, what have you seen out there with the chronic pain community out there as far as being able to get treatment? Because
I know what you're talking about.
Okay. Thank you, Jesse.
Chronic pain patients are very discriminated against, especially in this opiate crisis of drug cartels and street addicts. The government, the CDC, gave us guidelines to go by to treat our pain management patients. Well, they meant nothing. I followed them, but they meant nothing. They are chronic pain patients, and me included, I'm included, and I feel this whole board thing was because I was a pain patient. That's why I was discriminated against. So chronic pain patients are being discriminated against unfairly. They are not addicts. They are dependent on their medication to relieve their pain so they can function normally. They have gateway receptors in their nerve cells that when the medication comes by in your bloodstream, it closes those receptors until the pain meds wears off. The opiate products that we have are excellent products. They work. They're all we have.
And they're safe,
until
right?
they develop something for pain.
Yes,
for chronic pain patients.
Right.
There's nothing wrong with our medications. The problem is the illegal street drug addicts and drug cartels. Our government has lumped them both together saying, if you take a pain pill, you're an automatic addict. That is not true. It is not true, and it never has been true. But there are people and doctors that have used and abused medicines and all that. I admit that's true. But I'd say the majority of us are honest people. We are not using pills because we have to, just to be normal. We have to take pain medicine because we want to be normal. We want to go to work. We want to live productively. We want to shop at the grocery store. Mm-hmm. And so the chronic pain patients, the doctors are being so discriminated against right now that if they write an opiate prescription, they are in fear of losing their license, because the pain patients they're easy targets for the DEA, because they do not, they can go in and they can scoop out a doctor's office and find he's written 5,000 prescriptions in the last 3 months, which is normal. Some patients have 3 medicines they get for narcotics. But to combine the medicines at low doses to work, there's nothing wrong with that. Well, they are practicing medicine as they were taught.
I think it goes a lot deeper than that, though, too. I think they're looking for money as well. Like if a doctor has a lot of money sitting around, you know, I mean, and, you know, they're going to go in because they'll get like, I think 70% of that, of whatever they take and seize, regardless if they lose, win, you know, found that they're, you know, okay or not, or guilty or not guilty.
And where does that money go, Janelle? Where does that money go when they collect all the doctors
where does
and
it go?
Nurse practitioners' assets?
Who's getting
Where does it go?
Exactly.
Is it into a fund with the DEA? Where does that money go? You know, it's certainly not helping patients. You know, it's not doing any good. It's just ruining the doctor's life, or the nurse practitioner or the physician assistant's life. They're ruining their careers.
Of course.
But where does that money go?
I you know what? I don't know.
That's what I want to know.
I'd like to know that too.
Yep.
I wanted to know also, how is the medical field overall thinking about chronic pain patients on overdose and addiction? I mean, are there a lot of addictions or overdoses from chronic pain patients? Did you see it?
Not the chronic pain patient, unless the chronic pain patient has other problems. When you see an overdose, like from Phoenix, Dr. Grant. Okay, we had one patient overdose. Well, there was alcohol involved. There's usually at least 3 other medications, whether it's drugs or alcohol involved. This person is not taking their pain medicine as directed. Mm-hmm. So those kind of overdoses happen when the patient will go on the street, get other drugs involved, heroin, meth, whatever they get, and alcohol. That's what we see with an overdose, and that's not being reported. When you see an overdose, they say, "Oh, that was a chronic pain patient and overdosed on their medicines." No.
Well, that's why there's problems with the CDC guideline. Right. Well, I mean, that's why, you know, when they found out the inflated overdose numbers from the CDC, I mean, it's pretty bad, you know. I mean, they're counting 4 or 5 different things for whatever drug was in their body, and they're saying that they overdosed on all of them. That's not correct, you know. I mean, it should be one patient.
No, it isn't.
One
and
person
that's
died.
What I've been researching too. Mm-hmm. That's what we brought out in Washington. That is what we've got. 26 million chronic pain patients in the United States.
Yep.
And most of those patients, the majority, use their medicines as prescribed. We teach them, lock them up in a safe place. Do not let your children get a hold of them. This is my license. You have a relationship with your patient. You know that your patient, what they're taking. I've had you get a contract with your patient every time you have a pain management. I followed all the CDC guidelines, and you know what?
What did you think
now
of the CDC guidelines?
Study.
I mean, did you believe in them?
They've done no good. Mm-mm. They've done nothing. They've done studies now. These CDC guidelines are hogwash. They should be made up. The guidelines
they're written by addiction specialists,
by pain management physicians.
Exactly.
Mm-hmm. Not the CDC and not the DEA. DEA is drug enforcement. Right. Take the drug cartels off the street, not the pain patients. Right. Let the pain patients work. Let them carry on normally. You know, don't take it out on our chronic pain patients. No, that is not the way you do it.
So I wanted to ask you, what did you do and say in D.C.? Mm-hmm. I know you were with me at the congressional briefing, and what did you think of that?
Well, it was a godly thing that I got connected with the Doctors of Courage.
Mm-hmm.
I believe it was God's connections that I have continued to pursue ahead and help to getting my licenses back, me working. So it was a godly thing that I met Dr. Myers and Doctors of Courage, Linda Cheek. We were all doing across the United States doctors, we're all going for the same thing, is our medical licenses have been taken unfairly. We've been discriminated against. So that was the cause I went for. When we got there, it got into a real... I was disappointed that it took a racial sickle cell predominantly got talked about and not our licenses. And I also wanted, none of Arizona representatives showed up. I had an appointment with Paul Gosar after, and I've still been speaking with Penny Pugh, his assistant, and I'm not getting anywhere. I went because I've been, now since I've surrendered my licenses in Arizona and California, I'm now getting federal exclusions. I'm on some list like a criminal. I've never had a crime in my life, maybe 3 speeding tickets in my entire life, but I'm on this federal exclusion list that says that I cannot participate in any Medicare or Medicaid funded program. So I can't even volunteer at hospice right now. Nothing. That I can't even volunteer. Yeah. And I'm being looked at as a criminal by our federal government. And that's why I went to Washington, D.C. And that's what I wanted Paul Gosar to help me with, was because I'm getting these exclusion letters this year. And that came from the Attorney General that followed suit after the Arizona Board of Nursing. Then California took my license.
Now, in your opinion, did anything good come out of being there?
Meeting you and doing this talk show.
Yeah.
And meeting the lawyer in California. He takes the crisis cases.
Yes.
That I called yesterday, him, and hopefully people are listening right now and can help, because this kind of discrimination against pain patients, it's got to stop.
Yes.
It's got to stop. And that's why I am an advocate for every pain patient. I'm on about 4 social media sites, but right now I can't give support because I can't act as a nurse right now.
Well,
I've been a nurse all my life, but I can't present myself as a nurse right now. I am declined from that status. It's like my career, UC Davis, never mattered. Wow. I'm an alumni, but I can't call myself a family nurse practitioner, physician assistant.
Well, I think, there's a few people out there that, I would like to hook you up with and see if we can help you out at all. Yeah, and
that's what's happening, Janelle. So I don't feel things were wasted all the way.
Yeah,
I feel
don't
like
either.
A lot of people didn't show. We thought we were going to show up, but darn it anyway, this was just my first time there.
Well,
so
this is the thing. This is the thing too, is people have to realize it took a long time to get here, even though it doesn't seem like it.
12
it did.
years.
Yeah, and it's going to take a long time to straighten this out. I personally have noticed a change. I see a change in language from top publications like, Washington Post, the Conservative Corner, I believe it is. I'm not sure. I've even heard, different people from the Trump administration are listening. You could hear their language changing. They know it's not it's an opioid crisis. They know that it's a manufactured fentanyl or illicit fentanyl issue. I'm starting to see that language. I don't know if everybody else out there is starting to see that, but I'm seeing that.
They should call it a heroin crisis. Heroin,
but it's not even that.
Fentanyl.
It's not.
That's the crisis.
It's not heroin though, because it was heroin back in 2010 to 12 or something around in there. Even this head of the CDC said that. But what happened was you can't even get heroin on the streets now, from what I'm hearing.
Well, they do here in our town. We have a heroin and meth crisis.
I understand, but the problem is though, is they're making pills and they'll take heroin or they'll take something, but they're adding this illicit manufactured fentanyl to it. you know, and I mean, and that's a killer.
And it's killing.
It's
and
poison.
I'm on a site. I also have a addict son, so I know that road. And I am on all the Moms for Addicts social media also.
Are you?
And in fact, my son is in detox right now.
Okay.
And so I know for a fact, you know, that he is an addict. He is a street addict, all right? And he has tried for years to get off this street addiction drugs.
You must be
terrified. So I support moms.
Right.
I support mothers for addicts. And we lose 2 or 3 of our adult children every day.
Wow.
Every day on social media. And I'm crying every day for these mothers and praying that I'm not one of these mothers.
Yeah.
And I don't want to lose my son. So I keep fighting for him. It's been 15 years since we moved here. We have a town that is heroin and meth.
Yeah, I know. It's terrible everywhere. Well, you know, you really, really understand this then. I mean, not only were you in the medical field, but you have, you know, family that have addiction issues, and you're a CPP. You're a chronic pain patient. So, wow.
And I'm a chronic pain patient. Now, why did God let me do all that? Because I'm supposed to tell the world my story.
You're supposed to do something.
That's why.
Yeah.
For chronic pain patients.
Well,
yeah.
You know,
for addicts, for chronic pain patients, yes.
I'm so glad we were able to have you on our show because, you know, I don't think a lot of people have that insight often. So, thank you so much for coming on.
God gives it to me for some reason. He knows I can take it.
Yeah, well.
I can take it. Even at 65, I can take it.
Well, Paulette, we're going to be wrapping up here, but I wanted to know if you wanted to share anything else that we missed, or I know you do some
I wrote
writing.
a little publication, 44 Years the Medical Profession, Good and Bad. It's not in any of the stores. It was only for medical students and nursing students to know what could happen to you. So you have to be very careful from these medical and nursing boards. They are not your friends. They are only licensing agents. When they get a complaint, they get a job. So they are not, I think, this is one of my big deals, Janelle, I have to say.
Sure.
There has to be board reform. They need to change positions every 2 years. The way they get a job at the board, I never knew this. And I thought somebody was watching over the board. In Arizona, nobody's watching over the board. There was this National Boards Council I called last week and asked them if you know what they are? They're a continuing education nonprofit organization. Nobody's over the Board of Nursing. The executive director of the Board of Nursing in Arizona is the queen bee. Yeah. Nobody disciplines her. Nobody. What she says goes. So if she doesn't want me practicing, I won't be able to practice in the state and get my Arizona or California license.
Well, again, I think what Dr. Mangino, right? I think what Dr. Mangino said about the federal thing, though, I think you should really look into that.
Yeah,
but it is a shame, though. What if this happens?
I don't know why the attorneys don't.
I don't know.
Go ahead.
Sometimes it just matters about what attorney you have. You know, I mean, not all of them are good. You know.
Teresa Sanzio is an RN and an attorney, and she can't even. She says every attorney here says that their hands are tied against the board. Nobody can come against the board. That's not the Attorney General's office, not the governor's office. All the governor's office does for the board is to appoint the members. They hand them their application to be on the board, and they get to sit there forever. And they have a paycheck from our taxpayer money. That's a crime.
Well, Paulette,
nurses,
I know it is. I know.
It should be lawyers and judges taking away somebody's career, not another nurse.
Yeah.
Not another nurse. It needs to be a judge that disciplines a nurse on a crime, not a gossip call.
Right. Well, Paulette, thank you again for sharing this. I mean, this is like so important.
Oh, you're welcome.
You know, and you know, if there's any way we can help out, I hope you can. And you know, maybe once this gets all untangled for you, you could come back on and share with us how that happened and how you did it. Because I'm sure this is going on with somebody else.
Anytime.
Yeah.
And I'll watch your show all the time, Janelle. And I want to keep connected with you and Dr. Klein. And I do feel that maybe we will get to Washington D.C. again for chronic pain
absolutely.
patients next year.
Yeah.
In a better, more funded way for our chronic pain patients.
Yes. You know, we were talking about that after this.
That was only the first.
Yeah, after the congressional briefing. I'd like to do that too, where we can kind of just stay right on point with doctors and medical professions and chronic pain patients, you know, so we could just stay right there.
And maybe we'll even be in on writing the new guidelines for the medical
Wouldn't
profession.
that be amazing? Right?
Wouldn't that be amazing?
Uh-huh.
Yeah, pain management doctors writing the guidelines. Now, wouldn't that be amazing?
Mm-hmm. Absolutely.
They're the ones that should write the guidelines for the pain management doctors and physicians, nurse practitioners. Yeah.
Well, I think we're all going to keep fighting here. No,
okay.
We will all keep fighting here until this is like over with, because this is just not right. It's a travesty. I mean, I don't.
Right.
I think they're going to look back one day and say, "Man, America really screwed up on this, big time, big time."
Yep.
So, all right, Paulette. Again, thank you so much for joining us.
Thank you,
it was
Janelle,
a pleasure
for
having
having me.
Yep. Thank you. Have a great night. And Carnation, don't forget to join us again next Tuesday with Dr. Klein at the Doctor's Corner, and next Wednesday with guest Dr. William Mangino. He called in tonight, so we'll have him on for a whole hour next week. And again, thank you for taking time out of your evening to join us here at Call Nation. I'm Janelle Elgaway, signing off until next Tuesday. Good night.
Listening to Conspiracies Against Wellness with your host, Janelle Elgaway. The opinions expressed on this program are those of the hosts and callers, and not necessarily those of EXG LLC, its employees, or sponsors. Copyright 2018 by EXG LLC. All rights reserved.